process that we undergo during this surgery is, first we enter the eye, we take out your cloudy or opacified lens, and then we put in a new lens. The second most common question that people have is what are the costs associated with this surgery? So the costs of this surgery, as well as any implant based surgery, perhaps would be broadly divided into two parts. One is our procedure and hospital infrastructure charges, and the other would be the implant charge. In this case, the implant being the lens that we are putting into your eye. The hospital charge obviously varies from place to place, with insurance, without insurance. But in Agartala, in ILS, currently we are charging 10,000 rupees for patients who are paying in cash, and on top of that you have a lens charge. Now this lens charge also varies according to the quality of lens that you are looking to implant. To go into the details of the types of lenses in this video would be a bit confusing and a bit too elaborate. We will touch upon this in another video. For now, I would like to say that the lens price ranges from right about 5,000 rupees to almost 75,000 rupees. So it's a huge range to consider. Usually people opt for something around the 10 to 15 to 20,000 range, as they are comfortable with that sort of a budget, and it also serves their purpose. But there are also special cases and special lenses which we will discuss in a later video, so that you can understand this topic much better. The third thing the patient asks is, will there be any pain? And the patient is a bit anxious regarding how to undergo it. So pain, like any medical procedure, is minimal, because we are not giving you a very large incision. We are doing it in a very small 2.2 or 2.8 millimeter incision, which is very small. If you consider 2 millimeters, if you can mark it out on a scale, you will understand how small it is. And it's a keyhole surgery at its finest, that's what I would say. And we are taking it out, doing this surgery mostly on drops, not using injections too. So I feel it wouldn't be a very painful or a discomforting procedure in most cases. Now, when should I get myself operated? Many people have this notion that I am doing fine, I can see, is it really necessary for me to get operated? In this regard, the only thing that I would like to say is your quality of vision is the most important criteria. Definitely, if you are not able to see, you will go for cataract surgery, otherwise you won't. But there are some other points to also consider. One important point is your age. Now, age is a big factor, because any surgery on your body also requires your body to heal, and this healing process is significantly retarded as we move on in age. So a person at 65 would heal much faster, much better than a body at 75, much more than a body at 85, and so on. So to delay your surgery unnecessarily beyond a certain point would only jeopardize the healing process that would follow a surgery. A surgery is a 15-minute procedure, but your body takes 7 days to recover from it, to heal from it. And the more better physically you are would help that healing process to come across much faster. Also, as you age, your lens quality also starts deteriorating. It starts getting bigger in size and also harder, and that makes it a bit more difficult for us to remove, because we are breaking this lens into small pieces and then we are bringing it out through a very small incision. Now obviously it is common sense that a softer thing would be easy to break and a harder thing would be much more difficult. An eye being a delicate structure, breaking a lens with a lot of energy and a lot of manipulation would only result in that healing process getting further delayed. So for a patient having diabetes and other comorbidities, or not doing so well physically, or not anticipating that they may be doing so well physically after a few more years, it's better to get it done so that your quality of vision is restored and the surgery is also so much so uncomplicated as much as possible. The next points are, sir, what are the problems that we might face? What are the restrictions that we are going to undertake? And so the restrictions are very simple. It's only a 7-day restriction where no water must be entering your eye. It's just a precaution so that you don't use any unclean water and there is no infection that gets into your eye, because the surgical wound typically takes 7 days to heal. So we usually recommend a patient not to have a head bath. The patient may have a bath, but just to avoid pouring water on their head and hence into their eyes for a period of 7 days. That's the max that we usually recommend. Thank you everybody. These are some common questions that we have touched upon. In the next video we could elaborate on some subtopics further. Thanks for watching, and hope to see you, and hope that I have dispelled some of your anxieties and some of your fears regarding this widely performed procedure throughout the world today. Thank you very much.